Hi, welcome to today's video. Today I want to discuss being diagnosed as an adult with autism, which I was, specifically Asperger's syndrome, and what that means when you're just diagnosed and moving forward. I find that discovering as an adult that you're autistic, there are many of the same hurdles that children have when they're diagnosed with autism that adults may face as well. Things like speech and language, occupational issues, sensory issues, motor skills, things like that. Now, I have found that whether you're a child or whether you're an adult who has been late diagnosed with autism, things like language therapy, various occupational therapies, cognitive behavioral therapies, social skills training, and sensory integration therapy can be just as important whether you're a child or whether you're an adult. However, I think, at least for me, it goes a lot deeper than that. For me, doing and taking the therapeutic steps that I personally needed to really get myself better aligned also meant actually getting to know who I was for several decades, to integrate myself into a world that I naturally just don't fit into. I did a lot of masking. I've done a previous video on masking that is also on my channel. And it got to a point for me where I did mask so much that really, when it came down to being diagnosed, my first question was, now what? What do I do with this? And doing things like sensory integration therapy, and why I started CBT, or cognitive behavioral therapy, I found that at least with the individual I worked with, there were some similarities in things that I was already doing that I was actually trying to do less. There's a real balance that I don't think has been necessarily struck in the world yet when it comes to managing different traits and behaviors of autism, and a lack of balance between what autistic people do to try to fit better as opposed to the rest of the world. I don't think doing nearly enough to reach out and meet us halfway, build a bridge to us, and allow us to really cross into the world together. Getting to know myself after all the time of not knowing I was autistic and hiding much of who I actually was as a person, I found that I was very foreign to myself. And part of my journey to being able to do more things in the world, have more confidence, and not so much a drive, but an actual interest of going out and being around people and doing different things, going to different engagements, really meant me finding my own personal balance as to how I plan to go. I do a lot of pre-planning with, what time to arrive, where's really the best place in an area for me to kind of hang out, something that's not too busy, too loud, things like that. But moving on, when it comes to a variety of therapies, there's also one that is still very highly controversial, and that's ABA, and that's applied behavioral analysis. There are those who say that it works very well. There are some who experienced it and tried it in the past where the outcome was not so good for them. I won't hold any judgment on any types of therapies that I talk about or treatment options that are available out there to help really manage and help kind of keep and create a better outcome for autistic people. I won't lay judgments on a lot of that because literally everyone is entitled to an opinion. Everyone has the ability to choose what they think is best for them. And that's not up to me. That is up to literally everyone else. I can only choose for myself. However, when it comes to therapies, here in America, all 50 states have a requirement that therapy and treatment for autism, whether you're a child or an adult, has to be covered by insurance. The one thing that I have a concern about, not a judgment, but a concern, is that it's more likely to be covered by insurance if it's listed as ABA. There are not a lot of options that I found where other types of therapies are covered as vastly across the country, at least this one, as it is if it's listed as ABA. That's something that I think insurance companies should take a look at and maybe even reevaluate. Trying to make the assumption that ABA, no matter how it's tailored, is a fit for absolutely anyone on the autistic spectrum would be like saying that Cheerios is just the ideal cereal for everybody. To me, that is ludicrous. Okay, so the mailman showed up with a package, rang the doorbell, and so between me getting the package and trying to keep the dog inside, it was a little bit of a wrestling match. So it was pretty distracting. So we're just going to pick up where I left off in the discussion. So as I was saying, another issue that I have is just how underfunded autism research is. According to Massachusetts General Hospital, autism is now one of the fastest growing developmental disorders or disabilities, however you want to phrase it, in the country as it relates to children. This is growing fast. This diagnosis is growing faster than childhood cancer, childhood diabetes, and childhood AIDS. Now, there are two opposing factions on this view. One side says that autism is now being overdiagnosed, and the other side says that autism is still very much undiagnosed or underdiagnosed among children, but also I have found among adults. There is a phrase that I saw that said a lost generation of adults who are undiagnosed with autism, and I found that rather fascinating, yet kind of disturbing, all in the same note. Right now in America, the average time it takes to receive a diagnosis of autism is anywhere from 3 to 4 years. And for me, I thought that's quite a bit of time. However, when you dig in, you have to understand that there are no tissue or blood tests or CT scans or x-rays or anything that really for modern medicine to actually diagnose autism in a manner that so many are used to having disabilities or disorder diagnosed with. So that also, I think, plays a big part. But the amount of funding that is lacking when it comes to research in autism, I think, has also a very big part to play in that. Now, going back to being diagnosed as an adult. As an adult, receiving a diagnosis of autism, there are a lot of things that you'll have questions about, and you'll want to ask, professionals, what kind of options do I have? How do I begin to manage? How do I begin to really understand these things about myself? And the biggest, most important thing I can tell you is that don't listen to just one or two. It may take talking to several people. Do a lot of research online and discover your traits and your behaviors, because that's going to go a long way into helping you discover the best strategy that you can take for increasing some better outcomes when you're in the world, when you're working, when you're socializing. And also, it's important to understand that no matter what they tell you, you have to do what's best for you. If you disagree with the direction that a clinician or a therapist or psychiatrist is trying to lead you down, you have a voice, and it's okay to tell them that you aren't comfortable with the direction that they're trying to take you down. Only you can really discover and understand what is going to work best in your situation, which is why knowledge and understanding and doing your own research on this is so very important as an adult. When it comes to the diagnosis, it's important also not just to talk about this with professionals, but once you've had time to really personally process the diagnosis, it's also, for me personally, I found a very positive experience was slowly telling close friends and family about the diagnosis. Naturally, they had questions. I had the knowledge and understanding from my own research to explain to them kind of how things worked. And once I did that, I found that they very quickly were able to pick up on the various traits and behaviors I had. And once I explained this to them, it made a whole lot more sense. And what it allowed me to do is quickly build a very broad, very compassionate support group of people who had known me before my diagnosis. And now that I understood myself more and I was able to convey that to them, it made the friendships and the bonds a lot stronger in the end. And these are people that I can text or call or go to, and I call them human anchors. When I go out and do things with them, there is a much more built-in comfort level of, even though I'm out in the world and I'm not at home, having those anchors with me tend to produce a better outcome. Slowly but surely, I'm doing more things without one of my human anchors and really kind of testing the waters there. But just knowing that I have people I can call on in my life that will take the time to go and do things with me and even some of the same things we like, or something that I like that maybe they have not as much interest in. The fact that they will take the time to do that means the world to me. And I consider it one of those intangible wealth categories. So honestly, I feel like I've kind of droned on the last few minutes on this. Before I close, above all, if you're an adult who was diagnosed with autism, whether it was years ago or a month ago or even a week ago, just know that taking the time to discover who you actually are, if you've hidden so much of yourself away that you feel foreign, taking the time to do that, I think can really make all the difference in your next steps forward. So I'm going to close today's video. I hope that you have liked today's video. If you have, please give it a like. If this topic is something of interest for you, I hope you'll consider subscribing and ringing the bell so that you'll be notified of the next video when it comes up. Now, I will tell you for the next video, I want to cover a little bit more on a type of not so much a treatment, but an adaptive way of thinking called energy accounting method that I found, which actually came from the mind of an autistic advocate, Maha Tudal. I don't know if I'm saying the name right, but I did some reading on energy accounting method, and I found this to be very fascinating, and something that I found that I was kind of already incorporating into my own life. So that's going to be the next video. I am so grateful that you stopped by the channel today and took the time out of your busy day to watch this video. I hope that life is treating you well. And for the neurotypical world and all of the neurodivergence in it, I wish you a good day, and I will see you on the next one.